The introduction of the scientific paper titled, Measuring Acute Effects of Subanesthetic Ketamine on Cerebrovascular Hemodynamics in Humans Using TD-fNIRS, discusses the importance of quantifying neural activity during the administration of psychedelics to understand their effects and mechanisms of action. The paper focuses on the use of time-domain functional near-infrared spectroscopy (TD-fNIRS) to measure acute brain dynamics after the administration of subanesthetic ketamine in healthy participants. The study is a single-blind, placebo-controlled study with a non-randomized design. It aims to investigate the acute effects of intramuscular ketamine, 0 mg per kilogram, and placebo, saline, administration on brain dynamics in a clinical setting. The study included 15 healthy participants, with a nearly equal gender distribution and an average age of 32 ± 7 years. The results of the study showed that ketamine administration caused an altered state of consciousness and changes in systemic physiology, such as an increase in pulse rate and electrodermal activity. Furthermore, ketamine led to a brain-wide reduction in the fractional amplitude of low-frequency fluctuations and a decrease in the global brain connectivity of the prefrontal region. The study also found preliminary evidence that a combination of neural and physiological metrics could serve as predictors of subjective mystical experiences and reductions in depressive symptomatology. The paper highlights the successful application of TD-fNIRS neuroimaging to study the physiological effects of ketamine in humans. It emphasizes that this study is an important step towards larger-scale clinical fNIRS studies that can quantify the impact of psychedelics on the brain in standard clinical settings. The introduction also discusses the background and significance of ketamine as a treatment for mood disorders, particularly depression. It mentions that conventional antidepressants targeting the monoamine system have limitations and that ketamine has emerged as a promising treatment option due to its rapid-acting antidepressant effects. The administration of ketamine has also been associated with psychedelic effects, which have led to increased interest in studying the physiological and neural effects of psychedelic drugs in general. The introduction further highlights the challenges in establishing consensus between outcome metrics in neuroimaging studies of psychedelics, mainly due to small sample sizes, differences in dosing protocols, control conditions, and analytical methods. It emphasizes the need for larger-scale studies to establish reliable neuroimaging biomarkers for diagnosis and treatment optimization in psychiatric populations. Lastly, the introduction discusses the use of fNIRS neuroimaging, specifically TD-fNIRS, as a promising tool for studying the acute effects of psychedelics. It describes the advantages of fNIRS over other neuroimaging technologies, such as its scalability, ease of use, and comparability with fMRI measurements. The paper mentions that this study is the second fNIRS neuroimaging study on the acute effects of psychedelics and the first fNIRS study with ketamine. In summary, the introduction provides an overview of the study objectives, methodology, and key findings, highlighting the potential of TD-fNIRS neuroimaging to advance our understanding of the acute effects of subanesthetic ketamine on cerebrovascular hemodynamics in humans. Overview of study design and usage of whole-head TD-fNIRS neuroimaging in a clinical environment. The study design consisted of 4 study visits conducted in a pre-defined order: screening visit, dosing visit 1, saline, placebo, dosing visit 2, ketamine, and a follow-up phone call. During each dosing visit, participants underwent a baseline run followed by a bolus intramuscular injection of either saline or ketamine. Participants wore the Kernel Flow 1 TD-fNIRS headset, which consists of bilateral frontal, temporal, visual, and sensorimotor plates. Additional sensors were used to measure physiological measurements such as pulse rate, PR, electrodermal activity, ETA, and end-tidal CO2, EtCO2. The amount of ketamine administered was based on participant weight, with a target of 0.5 mg per kilogram, not to exceed a total dose of 60 mg. Participants completed surveys at different time points to evaluate the subjective effects of ketamine versus saline injection. The subjective measures showed higher scores for mystical experiences and altered states of consciousness after ketamine administration compared to saline. The ketamine dose also resulted in a reduction in depressive symptoms based on the Quick Inventory of Depressive Symptomatology, KIDS, questionnaire. Robust physiological measurements with the kernel flow 1 TD-fNIRS system reveal significant differences between the ketamine and saline dosing sessions. The kernel flow 1 TD-fNIRS system demonstrated robust measurements of pulse rate (PR) that were highly correlated with measurements from an external photoplethysmography (PPG) sensor. The PR and pulse rate variability (PRV) extracted from the TD-fNIRS system showed significant differences between the ketamine and saline dosing sessions. The PR increased significantly more during the ketamine dosing session, while PRV was significantly lower during the ketamine dosing session. These findings were consistent with previous literature on the effects of ketamine on cardiac signals. Changes in whole brain fractional amplitude of low-frequency fluctuations, FALFF, following ketamine administration. Ketamine dosing sessions showed a marked decrease in FALFF compared to saline sessions, particularly in the later part of the session. The decrease in FALFF persisted for at least 30 minutes after the injection. The reduction in FALFF was more sustained than the increase in pulse rate (PR), suggesting independent effects of ketamine on FALFF and the cardiovascular system. Cortical functional connectivity derived from TD-fNIRS and its acute changes after ketamine versus saline administration. Functional connectivity analysis using TD-fNIRS data showed a significant reduction in prefrontal global brain connectivity (GBC) during the ketamine dosing sessions compared to saline. The distribution of prefrontal GBC was significantly shifted to the left, indicating a decrease in connectivity. No significant modulations in specific connections were observed between ketamine and saline dosing sessions. Physiological and neural features and their relationship with subjective mystical experiences and depressive symptoms. A linear regression model using time-varying features of pulse rate (PR) and fractional amplitude of low-frequency fluctuations (FALFF) from TD-fNIRS data successfully predicted participants' total scores on the Revised Mystical Experience Questionnaire (RMEQ). The model performance was significantly better than chance level, indicating the predictive power of these features. Participants' time-varying RMEQ scores showed individual variations in the peak of mystical experiences after ketamine administration. In addition, a general linear regression model revealed that the interaction between whole brain FALFF and session type, ketamine versus saline, significantly influenced the change in depressive symptoms measured by the Quick Inventory of Depressive Symptomatology, QIDS. Participants with higher FALFF showed a larger reduction in depressive symptoms after ketamine administration. Overall, the results of this study showed that the kernel flow 1 TD-fNIRS system provided robust measurements of physiological signals and demonstrated significant differences between the ketamine and saline dosing sessions. Ketamine administration resulted in higher scores for subjective mystical experiences, altered states of consciousness, and a reduction in depressive symptoms. Changes in cardiovascular signals, whole brain FALFF, and prefrontal cortical connectivity were observed following ketamine administration. The combination of physiological and neural features showed promise in predicting participants' subjective experiences and depressive symptoms. These findings contribute to the understanding of the effects of ketamine on brain function and its potential therapeutic applications. The discussion section of the paper presents the findings of the study and discusses their significance. The researchers used neuroimaging techniques to measure the effects of ketamine on participants' altered states of consciousness. They compared the effects of ketamine administration to a placebo condition and found several reliable physiological and neural measurements that differed between the two conditions. Physiological measures included increased heart rate, decreased heart rate variability, increased oxygenation in the brain, and increased electrodermal activity during ketamine administration. Neural measures showed a decrease in brain activity and functional connectivity in the prefrontal cortex following ketamine administration. The researchers were able to predict participants' self-reported experiences using a combination of physiological and neural features. They also found that the timing of the peak mystical experience varied among individuals. These findings have implications for the use of ketamine as an antidepressant, as subjective experiences during treatment have been suggested to affect treatment outcomes. The decrease in brain activity observed in the study aligns with previous findings and provides a potential mechanism for how ketamine alleviates depression symptoms. However, caution must be exercised when extending these results to clinical populations. The study also found a decrease in global functional connectivity in the prefrontal cortex after ketamine administration, which is contrary to some previous studies. The researchers acknowledge that larger studies are needed to draw definitive conclusions and that there are limitations to the functional connectivity estimates obtained with the neuroimaging technique used in the study. The researchers emphasize that the study was a proof of principle for the use of the neuroimaging technique in clinical settings and that further research is needed. They suggest that the technique, which measures cerebrovascular signals, offers a scalable and ecologically valid approach to studying the effects of ketamine and other pharmacological interventions. They note that combining multiple imaging modalities, such as EEG and TD-fNIRS, may provide a more comprehensive understanding of the impact of psychedelics on the brain in clinical settings. If you are an author or copyright holder for the work presented in this video and you have any issue with the existence or contents of this video, please let me know.